and live longer with Dr. Anthony Gonzalez. We're here with another important health topic. If you want to live longer, you don't want to get burned. Getting burned is a problem because 1 million people get burned every year in the United States. And the numbers are 50,000 people a year are hospitalized because of burns. So today, we want to bring awareness about burns and burn awareness. What better than somebody who is a burn expert, who treats patients who have burns? We brought a friend, a colleague, Dr. Ricardo Castrellon. Welcome, Ricardo.
Thank you, Tony. Thank you so much for having me here. This is great.
Well, tell us a little bit about yourself, because a burn expert, what type of doctor are you and how come you take care of burns?
Yeah, so it's interesting. So I'm a plastic surgeon by trade, but before I did that, I'm a burn fellowship trained as well. So I did my 5 years of general surgery. So I completed my general surgery training and I completed critical care training. I wanted to become a plastic surgeon. So I think becoming a burn surgeon is something that happened on the process. And after I did my critical care and trauma training, I was still pursuing plastic surgery, and I ended up doing a burn fellowship in Indiana University where I trained. It was part of the plastic surgery program. It's interesting that the Division of Plastic Surgery was managing the burn unit there, and that was my route. So I ended up becoming a plastic surgeon and a burn surgeon at the same time.
Wow, that's great. And you'll explain to us that that plastic surgery and burns does go a little bit together, because burns obviously are wounds, and plastic surgeons are experts at closing wounds and covering the skin. Is that right?
That is correct. Yeah. Burns are very complex. I think one of the parts that happens with burns is that people don't realize that burns are very disabling. And one of the things that happens with burns is that it also causes deformity. It has wounds, like you said, pain management, and it is a very multidisciplinary. It's a very multidisciplinary management that it requires, and plastic surgeons definitely are the helm of it. As you mentioned, they have large wounds which require obviously closure, and more important, correction of the deformity and reestablishing of the function, which plastic surgeons do. People think that plastic surgeons only do breast augmentations and tummy tucks, but we also reconstruct, and the idea is bring form and function in patients. So that's where the key of a plastic surgeon comes into burn management.
All right. And we're going to talk about that a little later. I think that people don't realize the deformities that occur with burns, but let's save that for later. So let's first talk about burns. Yeah. What are the type of burns that exist?
Yeah. So burns are, by definition, people think it's only like a flame burn, but burns are an injury that is caused by the transfer of energy to tissue that causes injury. So it could be radiation. The most common one is the sun. So the people don't think about it, but sunlight is the most common radiation. People think it's related to nuclear things that are going to explode or, medical, but no, the sun is the most common radiation or exposed. Electrical is one. Fires, which is thermal injuries, is the other one that comes obviously to everybody known. And chemical injuries that can happen at home, but more important in the industry. So there's really 4 types of injuries, but the most common ones that we tend to see are actually the thermal injuries, the ones that happen at home.
And you talked about sunburns. I mean, people can get 1st degree, 2nd degree sunburns, right? Yes. I mean, so the sun exposure is not good.
No, not good. Especially
it's not good. Also, as a plastic, put down your plastic surgery hat.
Exactly.
It's not good either. Not to look beautiful. You don't want to be sunburned.
No, and in the long term, and so sun is good for you. I will tell the people. I'm not going to say people shouldn't get a little bit of sun exposure because it gives you your vitamin K and vitamin D, and you can actually be able to process it. So you need some little sun to your body, but the reality is that if you have too much sun exposure, you are going to obviously age faster because it's radiation. Your skin is going to age faster. And the other thing that's going to happen is going to put you at risk of skin cancers. That could be another whole topic conversation here, especially in South Florida. But yes, if you have a prolonged exposure to the sun and you don't wear a sunblock, you can get 1st degree and 2nd degree burns and heat exhaustion. And you can have a heat stroke and end up in a hospital with problems. So definitely the sun is something that shouldn't be taken lightly. And what happens is you get people who travel here from the north and, they want to get their suntan and they want to get it all in one day. And that's not a good thing. If you want to get a suntan, do it slowly over a few days. Let your body adapt to it, but don't try to do it in one day.
It turned red like a lobster.
Exactly.
All right. So I said statistics. There's a million burns a year. Give me some statistics on burns. How common is burns? Because I know, you were running a burn unit down here in South Florida. Yeah. So what are some of the stats?
So the statistics, it's people don't know it, but it's actually between the 4th or 5th leading cause of death on non-accidental death on patients. So people got to understand this. So it's fairly common, and you can have between, depending on data and what you read about, it could be around between 1 million to 600 700,000 burn that happen that are treated, and that's something that we're recognizing, because there's a lot of other smaller burns that people are treated. There's the ones that are recognizing. So you can imagine the number is bigger, and then from that we have a significant amount of mortality. We have around 70 to 80,000 patients who are treated in a hospital, and then there is around 3,000 to 4,000 deaths yearly from burns.
Wow.
So yes,
Yeah,
they're
people
very
people
frequent.
don't
Yeah.
realize it.
Yeah.
Okay. And then you also mentioned, we talked about this, and I wanted to wait till we were really live.
Mhm.
Times of the year where it's more likely to get burned,
Yes.
with the exception of a sunburn in the summer. But
Yeah.
talk to us about that.
Yeah, so times of the year. So it's interesting, especially I think what the conversation I mentioned is that obviously we don't feel it here so much in Florida, but up in the north when it's colder, when winter comes in and it starts getting colder, there is there's a higher incidence of burns, and the burns can occur obviously from water heaters, from the heater elements at home. And then the other thing that happens is sometimes and one of the things that we don't recognize is that sometimes even burns are associated with death and inhalation and carbon monoxide. So what happens is that the heaters at home sometimes are not clean, and those might generate carbon monoxide, and people will get poisoned. So you sometimes feel like a family died of inhalation, and if they were sleeping, they don't realize it. The other thing that happens is, and I've seen, we saw a trend was when people had this hybrid cars. Sometimes you would come in, go home, turn off the car, you don't realize the car is hybrid, and then it turns back again, and then the car was running in the garage, and then people would end up getting poisoned. So fairly common. Well, that's not fairly common, but it did happen. We've seen also a trend with people with electrical cars getting plugged at home and then having a house fire. Not very common, but it does happen. I actually had one of my medical students, it happened in his house. And so people don't realize it does happen. So you got to be careful of those things, especially when the warmer season comes in. In Florida, it's kind of always a colder season. In Florida, it's always kind of warmer, but we tend to see more burns when people are doing the barbecue. During the barbecue season, we also tend to see that. And I think that's more of a South Florida kind of thing.
And the barbecue here is all year around, probably, right? So
Yeah.
all right, and we're going to talk about that. You really led into the prevention.
Yes.
And I think, we learned in medicine here, every guest that I have here, prevention is most important. Preventing cancer, preventing heart disease, preventing obstructive sleep apnea. It doesn't make a difference who do I have here.
Yeah.
So let's talk about some measures of prevention for burns.
Yes. So I would like to say that one of the things that we should do is think, where do the burns happen? And most of the burns tend to happen at home, right? So the kitchen is the number one place that you got to think about. And I think one of the things that people don't realize is that, and I see this in a very common situation when people have grease fires, or there's a fire that catches up in the stove and they don't know what to do. Some people think, I'm going to throw in water, and that is a no-no. Water will make things worse. Or people will tend to take the hot pot and run with it and take it to the pool or somewhere else, and meanwhile the hot oil is falling on them, or they catch on fire, which is a no-no. Ideal situations, and people should have, in the ideal situation, all of us should have at least a fire extinguisher in the kitchen. And not any fire extinguisher. You got to make sure that because fire extinguishers actually work for different situations. So there's a couple of fire extinguishers. There's a classification goes A, B, C, and it has several numbers. The key word here is BK, like Burger King. That's the way that I think about the flames, because the B and the K are going to be the fire extinguishers that are actually going to fire or stop, that are going to stop grease burns. But in case, so that's a good thing.
You need a BK fire extinguisher.
Exactly, B or K fire
B
extinguisher.
or K.
Exactly, yeah.
Okay. And is the size important?
Well, enough. Yeah, usually they will have a smaller ones that will be
that's okay. That's
okay. Just a small starter to stop a small fire in the kitchen. The other
if it's
thing
bigger than that, you probably shouldn't be getting out, right?
Exactly. Yeah, big fires, you'd probably be running out, calling 911.
Okay.
But in the kitchen, the other thing is that people tend to commit the thing. Well, I'm going to throw in some water on it, and water worries me because water can actually, if you have a grease burn, the oil will be on top of the water and will actually make the fire worse. So you don't want to do that. And some people will say, well, I'll throw flour on it, and flour can actually make it worse. So don't throw flour, don't throw any other things that are going to potentially make it worse. One thing that you could do is there are some fire retardant aprons. They sell them. They look like fire retardant blankets. You should have one of those. They sell them online.
You throw that.
You'll throw it on top, and that will take the air out of the fire, and it will stop it. Or the other thing is having a big lid. Sometimes when you're cooking, you should have a lid that is bigger than the pot you're going to use, and that way you can do it really fast. And obviously wear appropriate equipment or proper, the gloves to be when you're cooking, especially when you're cooking with hot oil. That's one of the biggest things where it's a grease that tends to catch fire. And another thing, if you cover it, don't take the lid off immediately, because people say, put the lid, just leave it. Don't take it and take it off, and then because the fire comes back again at you. So
Wow.
So that would be one of the biggest things that you should be doing in the kitchen. In the barbecues, if you're having a barbecue outside, make sure, especially with the gas barbecues, make sure that you are letting it vent. We've seen a lot of this burns with built-in barbecues, that the lines are open or something, or there's a leak, or you haven't used a barbecue in a while, and then the gas accumulates in the lower part of the barbecue. And I've seen people with flash burns in the lower legs. So if you're going to do a barbecue, you're going to light it up, make sure that you're seeing, and it's in an open place.
And the barbecue is open.
Exactly.
So that the gas is not contained inside the barbecue.
Exactly. Don't leave that line open without having it closed. Make sure that it allows to vent. The same thing, don't use gas. I don't know, for some reason people have gas or kerosene or something at home, and they throw it in. They say it's just a little bit. The problem is a lot of these flammable liquids actually have fumes. So it's not only the liquid you're seeing, but the fume is there, and that can also cause an explosion. So you got to be careful and cognizant of what you're doing when you're doing with the barbecues.
Talk to us about barbecues. Talk to us about, I've seen horrendous videos of the fried turkeys. I fry turkeys. And I am super cautious. Of course, I went through, not the training that you went through, but I went through a couple months of burn training as a resident 30 years ago. And those burns were horrendous, and I don't want to get burned. And very cautious. So those frying turkeys is dangerous.
Yeah, I imagine that amount of hot oil falling on you. That is terrible. Or that thing catches on fire. Like
I've seen that whole thing on fire.
That needs, obviously, number one, needs to be done outdoors. I would make sure that you have it outdoors, and you have secure lines, and your gas line and everything is well connected and tested before you're doing this, because the last thing you want to do is have grease and have all this oil and then a faulty line or something that catches fire. The other things you want to do, if you're going to drop it, you don't want to drop the turkey. Just drop it frozen immediately, or cold, or with water, because that's going to catch fire. You want to make sure it's pat dry. We're going to drop it slowly. And again, be wearing your gloves and be ready. You have to do these things, carefully.
I really encourage people to watch some good videos that there is online about how to fry turkeys.
Yeah.
I actually look at the video. I've been doing it for years. I look at the video every year, slowly dry the turkey. Things like you're saying, getting all the water out, dropping it in, not dropping it, putting it in slowly. Yeah. All right. So we talked about the kitchen. We talked about the barbecue. Any other areas for burns?
Bathrooms, you got to be very careful with the bathroom, especially with children. Make sure that the water heater, and most water heaters should be set at around 120.
I wasn't thinking about the bathroom.
Yeah.
People get burned with water, hot water.
Hot water.
I remember that kids used to get burned with hot water. Well, I mean, I remember that they still do get burned. But I remember I used to see them. Okay.
So you really want to make sure that you're watching the child and you're testing the water, especially for the child. And you got to make sure that your water heater, the settings are not greater than 120 degrees. The good thing about it is that regulation, at least in the United States, has the water heaters at an appropriate temperature. But I'll tell you where I still find that the hot water is a problem. Not at home. When you go to hotels and things like this, and you put the water is always burning hot. And I'm like thinking, you're going to go with a children, an older person goes into the hot water. You got to make sure you test that water before you walk into it. It's a very common place for burns.
Okay. What about electrical burns? I had an electrical burn as a child.
Yeah.
Or as let's say a teenager.
Yeah.
Talk to us about electrical burns.
This happens a lot, and I think we don't realize this, because one of the things that happen is as we become more dependent on battery-powered things, people are putting tons of plugs into things, and you're saturating the electrical system at home. And if it doesn't work, or you bought like a cheap, extension cord, and you put a million things there, and bought it at Temu, and the thing explodes, and you can get shocked. So one thing you got to make sure, if you're handling any electrical equipment, make sure your hands are dry. That is very important, because you see sometimes get out, take my computer or something and charge it in the bathroom. Oh, that doesn't sound good. You want to make sure that your chargers are away from that. The other thing that happens, especially like a teenager, I used to like to disassemble things, and I was working computers or things. Some of these things, electrical devices, especially if you want to play with them, some of them do have things that are called capacitors, and sometimes even when the plug is out, they still have some charge into it. So you touch these things and you can get shocked. So playing with electrical things or trying to do some of those home improvements with electrical things at home are not a good. I can tell you, when I was a child, my house got burned. My house went down. My mom's house got burned. And one of the things that happens, and we had some guy fix some air conditioners and install some new air conditioners, and I don't know. I have to blame my stepfather for that. I probably got a cheap guy there. The thing is that it saturated the electrical system. The house caught fire.
Wow.
So that can also be a good segue for a conversation about an escape plan. But electrical fires are things that you got to be. If you're going to be working on the electrical system at home, make sure that you leave that to professionals. Wear gloves, make sure that you're not doing things, because that's where I see that when we get the electrical burns, most of the time it's usually some professional who's working on the electrical high voltage situations, or in the industry. That's where they find themselves in those situations. And at home is when someone's trying to do something at home, trying to do some home improvement, or the situation where they probably saturated the system by putting too many plugs or connecting too many things. Especially people now go to sleep with, they go sleep with their phone charging at bedside. There's all kinds of things. The other thing that I've seen is people tend to use this heaters, the heater pads. And I actually want to tell you about this. Heater pads, you put them to charge. They're electrical, and you put them, you put them, and they're soft. The heated pads that people use when there's a little bit cold, and you feel it's not hot, but you fall asleep with that thing. That's a slow cooker, and some people fall. I've had patients who've gone to sleep with those heating pads, and then the next day they have a full thickness burn because they left that heating pad all day there. Because remember, it's just a slow little transfer of energy, but that slow transfer of energy, it's like a slow cooker that ends up cooking. Builds up. Yeah.
Wow.
Yeah.
Okay, so more than 1 million people get burned every year. All right. If I get burned, what should I do? Should I always go to the doctor? What are the recommendations? I had a small fire in the kitchen. Thank Dr. Castrellon. He told me about the B or the K extinguisher. Yeah. I put it out, but my hand got burned.
Yeah.
What should I do?
So, most burns are going to be small. Most burns are small, and sometimes if it's a little small, a little drop or something, most people won't be concerned if you got a little, like let's say you got a little burn to a fingertip and it's just something very small, you got a little drop of something, of grease into your hand. But the reality is any burn that happens to your face, any burn that happens to your hands, feet, or genitals, those are specialized areas, and genital burns happen all the time with people driving coffee and taking the coffee in the car. It's very common, get second-degree burns. But burns to those specialized area, that's an automatic, should go to the hospital.
So face, hands, feet, or genitalia?
Genitalia, that is correct.
They all should go to the hospital?
Yes.
Okay.
Any burn that is bigger than the palm of your hand should go to the hospital, should be seen by a physician. It can be an urgent care center, ER, but they should be, any burn that is bigger than your hand should be seen. And we talk about this. The hand is the technique that gets used, and we talk about it being like the rule of nines. But when you use your hand, the hand of the patient usually represents 1% of the body surface of the patient. So any burn that's bigger than your hand, you should be getting it to see.
Okay.
And if you're diabetic, if you have immunosuppression, have any chronic medical condition, you should be getting seen. Children should also be getting seen as well. Because with children, their physiology is different, and small surfaces actually do represent big surface area in children. Plus, we are always in the community, always looking, making sure. So sometimes one of the ways of child abuse or even elder abuse
is disabled or disabled
exactly.
People with disabilities are being abused. Yeah,
exactly.
Wow.
So you want to make sure that turns a red flag. So you have a child who gets burned, take him immediately, get him checked, because that's always a concern of us. Why does someone who has burns, especially in those situations, hasn't been seen? Yeah.
All right. So let's talk about what someone like you does. Patient gets burned. They go to the ER. Let's talk about a small burn. Maybe somebody goes home, and let's talk about some of the bigger burns, the second, third degree burns, and then we'll lead into that conversation about the contractures and all that other stuff that happens, and the hypertrophic scars and everything else. So what happens if somebody gets to the ER and they have like a burn? Let's say you have a burn right here on your arm, the oil spilled, and you got a nice burn on your arm. What happens?
So what happens with burns is that, and one of the things that happens with burns is, again, this transfer energy causes a damage, and the injury might not show immediately. The injury might show over a period of time, depending on how big the burn is or the location. There'll be indications for the patient to stay in the hospital or go home and have wound care and be followed up as an outpatient. But what happens is that if that wound does what we call demarcates and demonstrates it's a bigger area, what will happen is that wound will probably need to be cleaned. We will clean it. The word is, the medical term is debridement, but essentially what we're doing is scrubbing it, cleaning it, removing the dead tissue. Essentially what we're trying to do is remove the cooked tissue from your body. And what happens is, as the days pass by, we will be able to figure out how deep these wounds are. Your body and the skin has the capacity to regenerate itself. And that's where the importance of those first or second or third degree burns are important, because that will make allow participate in the decision making of what's the next step on the patient. If it's a superficial burn, and if it's appropriately taken care of, cleaned up, making utilization of certain medications to help the wound not get infected and clean, that most of the time will regenerate by itself. So most burns, especially small wounds, usually will heal around 2 to 3 weeks and should epithelialize. The deeper wounds, your deeper second degree and third degree burns, those are areas where the skin, the tissue, has lost that capacity to regenerate itself. In other words, it won't heal without help. Or if it heals, it's going to take a very long time, and it's going to leave very bad scars as sequela or contractures, like you mentioned. So in those, what we end up doing is we already know that that's going to cause a problem. It's not going to heal. So what we do is that we debride it and clean it. You say, why do you clean it? Because it's the same thing like when you do a remodeling in a house. What do you do in a remodeling? You have to do the demolition, clean up, and then you start the construction. Your body works in the same way. If you have dead tissue in your body cannot start that healing process. So we help the body by cleaning, doing the debridement, and then we sometimes use skin substitutes, and this helps promote this healing and jumpstart the wound healing. There will be situations where the burns are really deep, and then at that point what we make is a decision. And how do you cover it? You cover it with skin. And where do you get the skin? We take it from the patient. So we can use skin substitutes if it's a superficial one, or if it's very deep, then we take skin from the patient, and we take a very thin shave. So that will mean that skin that we harvest, it's going to grow back again, and we are going to reapply it to another part of the body. Now with newer technology, where we have devices where we can actually take a small amount of skin, chop it out in a million pieces, and then you can spray it on the patient, and it helps regenerate. So that's one of the cooler things that the technology is happening. So for some of our burns, we're able to do that.
Now talk to us about the importance of the hands, the feet, and the contractures, because when the wound heals and that skin heals, there's scar that develops, right? And that's the problem, right?
Yeah. So all wounds in your body are going to heal, in the humans, unless you're a baby fetus, are going to heal by scarring. So you're going to get a scar no matter what it does. Sometimes people say, oh, it's a plastic surgeon, it's not going to have a scar. Even being a plastic surgeon, there's going to be scar, because we all heal by scarring. But what happens with the scar, especially the scars related to burns, are very metabolically active. So the scar that the patient has, or when the skin graft is healing, or the burn that is affected is healing, it takes a period of time, and as the months go by, the scar changes, because it's almost like in a construction area. You can imagine that there is a cleanup crew and a crew that's depositing cement, and another one that's coming in and out. So the scar is changing over that period of time, and that's where it's very important, especially for like you mentioned, burns to the hand, extremities, joints. We have to be very observant and cognizant what's happening there, because you can develop contractures. Because one of the things that happens with any scar is that scars, obviously, they actually shrink in size. They have these cells called myofibroblasts, that will actually contract and make sure that reduce the size of the scar. And that is a good thing for protective purposes, the way that nature designed it. But when it happens in the joint or in a hand, that leads to contractures. It makes your hand become a claw, or restricts the range of motion, and you lose function. So patients that have burns in the upper extremities or any joint, we're working conjoined with the occupational and physical therapy to prevent those contractures. And if those contractures develop, then those are areas that will require surgical intervention, where we will actually release those scars and apply a skin substitute or skin graft, or do different techniques or flaps to try to prevent the reformation of the contractures in those areas.
Yeah. So I guess the take home message is, these burns can be very simple where you can care for them yourself at home. We're going to talk about that in a minute. There can be a little bit more complex where you need to show up to the ER if they're on your feet, your hands, your face, your genitalia. If you're a child, an elderly person, if you have medical problems, show up to the ER.
And big burns. Yeah. Obviously.
And big burns. Yeah. Anything bigger than your hand. Anything bigger than your hand. If it's a burn bigger than your hand, then the size of your hand, then you should show the ER. And then, it could be just simple wound care, or it could be everything from skin grafts to even contractures and even further surgery later in your life.
Yeah, that's correct. Right? Yeah.
Wow. So I guess that's the importance. And I think it goes back again to prevention. Prevention is the key. An ounce of prevention is worth it for sure. Now, those people that never end up in the ER, they get a small little burn on their hand, on their arm, whatever. What should they be applying on that wound, and what should they not be applying to that wound?
That's a great question, because one of the things that happens is that the burn is a tissue that is trying to make it, especially when you got that original injury, and people at home will get these things. They heard it from la abuela, the grandmother, someone in the community said, you do this and it's going to help you. With burns, and I see this all the time, people will put, for some reason, they like toothpaste, and I guess sometimes it has the mental, it might make it feel good. They will put ice. That's a no-no. Some people will put butter. They will put all kinds of things into it. With a burn, you really don't want to be applying any of those things, because that's going to make it worse.
No butter, no ice, no toothpaste.
No toothpaste.
Okay.
No vinegar. That's the other one. I see vinegar. People start putting vinegar. That is not a good thing. Burns, what you really want to do, if you get a burn immediately, what happens that you should do in your first aid is stop the burning process. So people don't think about it. What do I mean stop the burning process? Take the hand out from the flame. That makes sense. But let's say that you got hot coffee into your pants while you're dry. Ideally, you should take your pants off, because that heat is still being transferred. It's still burning you. So if you have, or grease falls into your socks, take the socks off immediately, because that's still part of the process. So stop the burning process and cool it immediately. Clean it up with water.
Cool it, but not ice.
Exactly, not ice, because ice will cause
a
type of burn, except frostbite. So it's a different type of burn. So try to do that. Pat it dry, protect it, cover it. You don't want to put anything else, especially for smaller surface areas. If it forms a blister, don't rupture the blister. Small little blisters, you can observe them. If it's a large, tense blister that it's forming, like I told you, again, hands, feet, or anything, those are things that are better treated by a physician, because automatically, if you open, that means you're coughing now and open to the wound, and you're putting yourself at risk for an infection. So patting dry after a burn. And in chemical burns, this is actually something very important that even sometimes you don't realize. It's like, people got liquid plumber at home, which is a very strong chemical. It falls on your hand, it burns, and people I put some water, I wash it, I took it off. No, especially with chemical burns, you want to have constant irrigation. And when I mean constant irrigation, you don't stop the irrigation. You're 20, 30 minutes irrigating, especially with those heavy chemicals, industrial chemicals. Wow. You really want to be at least 30 minutes and just irrigate with water. Don't put another thing, because people say, what's an acid? I'm going to put baking soda on it. That's not a good thing, because if you're trying to block, try to stop an acid with an alkaline substance, now you're going to cause an exothermic reaction, which is, in other words, a release of energy. There's going to be heat release, and you're going to make that burn worse. So best thing you can do is, in situations like this, safe to say, put water on it, let it wash, irrigate, pat it dry, cover it with a nice clean gauze.
Cover it with gauze, yeah. I think one of the basic principle for all wounds, people say, I leave the wound open so it can get air.
Yeah.
No, right? No. You want to cover a wound. You want to keep the wound moist. You want to keep it warm. You want to keep it covered and so forth. So
that is correct.
Yeah, I think no ice, no toothpaste, no vinegar. Wow, incredible. So we brought a lot of awareness with regard to burn awareness. We talked about preventing safety at home. Yeah. fire extinguisher, B or K fire extinguisher? I'm going to go home and check, make sure I have that.
And make
at
sure
home.
and make sure that your extinguisher is not expired. That's the other thing.
I was just going to say that there's a tag, right?
Yeah.
Okay.
It actually tells you the date of expiration, so make sure that it's working,
And
make sure that it works too, and actually be familiar with the mechanism. There's a mnemonic they say about path where you take the clip off, and the last thing you want to do is trying to figure out how to activate your extinguisher.
Well, there's a fire.
Well, there's a fire.
Wow.
Yeah.
Yeah, and if it's expired, these are disposable?
These are disposable, and especially and if you live in a building or different places, you should have, especially for people who live in high rises or buildings like this, you got to make sure that these are checked. They should be checked on a routine
But
basis.
for people that are in homes or in their own personal home, these are disposable, and you just get a new one.
Exactly, that's correct. Yes.
Great. Any words of wisdom for our community with regard to burns?
I think stay safe. Common sense is very important. And more important, always have a family plan at home. I think having a conversation with your kids and a family plan is very important, because this can happen to anybody. You can have your teenage daughter cooking. You can have a little kid or someone that's your grandparents at home. You have to have, or something can happen. Something can catch fire, and you don't think it's going to happen there, but it's very important to be ready. And discuss which is a fire exit. What should I do? So once you talk about these little things, because, a fire can be a little fire, you can extinguish in a couple of minutes, but in a couple of minutes, if you don't have a plan or you don't know what to do, this can turn into a big fire, and definitely could be a worse situation.
Wow.
Could potentially save your life. Yeah.
Incredible. Well, thank you. Thank you for what you do. Thank you for taking care of our burn patients in our community. And thank you for informing us and educating us again.
No, Tony, thank you so much. I appreciate the opportunity.
All right. Well, once again, Dr. Anthony Gonzalez here with Miami Community Health and Live Longer with Dr. Anthony Gonzalez. We're teaching you about safety, how to live longer, and avoiding a burn is going to help you live longer. Once again, take care of yourself and your family. Be well.
Thank you.